The rapidly spreading Ebola outbreak continues to spark fear, with suspected Ebola cases rising to more than 900 and over 220 suspected deaths recorded. A UN official said the WHO Director General would be traveling to Congo, where a critical aid shortage persists.
We have an update on the Ebola outbreak in the Democratic Republic of the Congo. According to WHO, there are more than 900 suspected cases and 220 suspected deaths linked to Ebola in the DRC. The head of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, announced that he would be traveling to the country today. In a social media post, he said WHO and 55 humanitarian partners are present across the affected areas, providing essential health services, including treatment for acute malnutrition.
Meanwhile, fighting between government troops and the Rwanda-backed M23 militia has been raging for days in the Eastern Democratic Republic of Congo. And according to security sources and locals, the mineral-rich region has been scarred by violence from various armed groups for more than 3 decades. The combat at this point in time is concerning because it is also ground zero for an Ebola outbreak, which has sparked international health alert by the WHO. The illness has caused over 200 deaths reportedly, according to a toll given over the weekend by Congo's health ministry. The Ebola outbreak continues to worsen there. A baby born to an Ebola-positive mother died in an Eastern Congo hospital. Health workers disinfected the treatment area before placing the baby's body into a body bag and sealing the coffin before carrying it out of the building. In fact, the WHO says the epidemic has been linked to more than 900 suspected cases, at least 101 confirmed cases, and around 220 suspected deaths in Congo and Uganda. The outbreak, centered in Ituri province, involving the rare strain for which there is currently no approved vaccine. Amid the worsening situation, doctors, relatives and Red Cross volunteers gathered in the eastern Congolese city of Bunia on Tuesday for the burial of a doctor who died after treating Ebola patients. And this has led to growing fears among the frontline health workers. WHO has said states neighboring Congo are at great danger from Ebola and should act immediately to counter the deadly virus. Other nations are also taking preventive measures. Thailand has imposed a 21-day quarantine order for people traveling from or having transited through Congo or Uganda. However, in a major breakthrough, Russia has claimed to have developed a vaccine that might offer immunity against the rare strain driving the current outbreak. And for more on these developments, our correspondent getting us this report. Take a look.
Eastern DRC is facing a dangerous crisis as Ebola spreads rapidly while heavy fighting continues in the region. The WHO chief Tedros has described it as a catastrophic collision of disease and conflict. Ongoing violence is blocking health workers and pushing thousands into crowded camps where the virus can spread even faster, prompting a potential increase in suspected cases and death toll. Calls for an immediate ceasefire are growing more urgent, but peace remains difficult to achieve. From Lagos, Nigeria, Louisa Olani, WION World is One.
To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.